Welcome back to the Full Arch Podcast. I hope you all are off to a great start with this new year. I'm not entirely sure where episodes are actually premiering and when you're going to hear things, so I'm just going to keep saying Happy New Year until it gets a little bit old. But hope you guys are off to a strong start. Dr. Clark Damon is with us again today. He had an absolutely brilliant idea that I probably should have thought of sometime before our 1 year anniversary. But we get so many inquiries into the show from people who aren't quite doing full arch yet, but they know that they want to. Sometimes it's people that haven't even really placed many implants, maybe just a few. Maybe they're just looking to get into it. They really wanted to do it. And so what Dr. Damon had figured is we could do sort of a 0 to full arch master guide for everyone to go from being implant naive to being confident in tackling even the most complex full arch cases. So we're not entirely sure how long this journey is going to be, but we're going to take our time with it. And our goal here is to help people go from that sort of 0 of just knowing that this is something you want to get into all the way to doing some really advanced stuff. And we want you to be able to get there as expeditiously as possible, performing really good dentistry all on the way and doing great services to your patients. So I'm really, really excited for where this goes. We also have Dr. Poppy with us here today, and I think we're about to have a really good time. But without further ado, welcome back, Dr. Clark Damon.
Hey, well, thanks for having me on, and it's exciting to be here. And, I guess today is January 23rd? And
Yes,
I was actually listening to y'all's podcast I guess over the weekend. It was one where y'all were talking about like the different courses y'all are going to take. And I think it was, you had actually said, I think that this is going to air on our 1 year anniversary. And so that was just a couple of nights ago. So congratulations to you guys for having a podcast. And, it's cool to be invited back. So I'm humbled. Thank you.
For sure.
Absolutely.
I mean, you've definitely been one of our most prolific and popular guests. So it's really cool that you wanted to come back on to our humble podcast. And also a special shout out to John Pratt, our editor. I'm not entirely sure if I mentioned that before, but he actually sent me a voice message congratulating us on 1 full year of the Full Arch podcast. So I want to make sure I mention him. It really wouldn't be possible without him. I think I would have already gotten tired of this venture, but fortunately we're able to just focus on the fun stuff. So
Yeah, well, I mean, it seems like you guys have a great. You've interviewed some really amazing people, and I was just listening to the podcast one night, and I was like, you know what, because the one that I did with y'all, I will get people sending me an instant an IM or a DM, whatever you call it now. They're like, hey, I listened to your podcast. It was really good. I enjoyed some of the pearls, and thank you. I'm a new grad. Where do you suggest I go? And what do you think I do? And I was just like, I think that you can't really talk about, a Full Arch podcast without kind of saying, well, this is how you put on your shoes. And this, this is kind of, well, let's kind of have a, from 0 to Full Arch. And, so here we are.
Yeah. Awesome.
Absolutely.
Awesome. Yeah. I think the kind of avatar for who we really want to speak to here is, even the dental student that's kind of maybe like late D3 going into D4. They're thinking about if they need to do a residency, they're getting an idea they really like surgery, but just haven't really been able to get their fingers wet with it. So that's kind of where we want to start. We want to give you guys some resources for every stage along that journey and really start to inform what that roadmap can look like. So it's an ambitious project, but I think to start, one place I'd like to kind of head it off on, Soren. So you are definitely, without question, the most well-prepared dentist coming out of school that we've ever met. And we've talked a little bit about what your background was getting into it, but can you talk a little bit about some of about the opportunities that you had in dental school to really pursue this and the kind of things that you focused on and how those have really led into you being able to do what you do now?
Yeah, absolutely. Well, I think it's really important if this is something that you want to do to kind of get your basics down first, right? So for me, D3, I started to kind of shadow some implant offices, and I realized that this is definitely where I wanted my dental career to go. And to get there, in dental school at least, one of the first things I did was I just went to all of my kind of clinical directors for perio and OS, and just told them, hey, I've been working really hard at getting all my requirements done. I would love to get some more experience with this type of dentistry in particular. And you'd be surprised, a lot of them, a lot of people they don't ask their course directors to get more experience in these different avenues, and most of them are pretty willing to just jump in and have you come, whether it's assist for cases or actually start doing some of these bigger procedures. They're pretty open to that. And I might have had a unique experience where my school allowed a little bit more of that, but I definitely, when I was in dental school, as a D3, I was starting to do, tori removals, full edentulation, stuff like that. And if you can get that experience in dental school when someone's over your shoulder all the time, it goes so far, because once you get out in the real world and you're starting to do full edentulations and stuff like that, there's no one there unless you have like a mentor doc at your office with you, but there's no one there to really tell you, hey, you're doing that right or wrong. So I was able to get a lot of experience with someone over my shoulder, learning tips for efficiency, how to reflect flaps properly, stuff like that. And then on my spare time, I would spend most of it reading implant books. And I think we'll go over some of those books and courses and whatnot, but implant books, any online CE I could. I hit up a lot of different people who were doing implant CE and asked them like, hey, can I get a student discount, just for coming to this? So that was definitely a great way for me to kind of incorporate myself and get a lot of that basic surgical experience. And without getting efficient and a lot of the basic surgical stuff under your belt, it's really difficult to kind of jump into some of these bigger implant cases. So I definitely would stress that if you're a young dentist, try to utilize some of the, your just cheaper student CE, online CE, stuff like that to get the basics down. And then when you jump into implant cases, starting like overdentures or single implants, it'll be much easier for you to get through those procedures and not have them take 2-3 hours.
Yeah. So I mean, I remember, there's always in the oral surgery department at UT Houston. I mean, this was back 2010 or whatever, but there'd always be the one instructor that would just make your day heck, and but then there'd also be the other instructors who are like, well, you can do that tori removal, and yeah, you come in and I'll help you do it. And so it's just kind of finding the right person to ask. I also think if you do like a oral surgery like externship, like your D3 D4 year, get into some of those, go spend a week somewhere, I think that would be huge. And it is the best investment that anybody wanting to do this can make if they go into a GPR or a AGDD, GPR or AGD, right? So, 1 year, you're going to make 40 grand versus your other buddies making 120, right? But like that's the best $60,000 you will ever not get. I mean, I can't tell you your income potential if you do that. And so, I think that's a great way to start. The other, what's up?
Can we get, sorry, Dr. David. Could we get, so I get a lot of questions about residencies and AGDs. Do you know of any in particular right now that you really like, that are beneficial towards this, where people are getting plenty of reps that you would really recommend people take a hard look at?
I was one of two GPR residents, and it was at the VA in Houston. And that is a phenomenal program. I mean, Dr. Steven Cedar, runs that program, and it is so good. Now, granted, there's a little bit of what you get what you put into it, right? But I mean, I spent 3 to 4 months with the oral surgery residents, and I mean, we were in the OR, several times a week, and like I'm there with the oral surgery, first years, and then also their chief, and like if I put my thumb through the needle holder, bam, the attending would whack me on the back of the wrist or whatever. They'd be sitting there saying, "Why are you taking so long on this case?" And I'm like, "We just extracted 32 teeth in an hour, and you're saying that took a long time." But that was a great one, and I still highly recommend, if there's any GPR program in the country that you can apply to the Houston VA GPR.
That's
The
great.
one that's run through the UT program, there's a GPR and an AGD. I don't think that one is as good. The other one that I know very well that does really good is the San Antonio AGD. Both of those two programs, I
I heard
think,
of
are
that too.
fantastic. I think the program in Dallas is at the VA. I think it is also good, but I think it's a little bit of a notch down.
I would like to say too that we talk to a lot of people that come out of the Foundry,
Hmm.
and I know that's a very good course or a very good AEGD or GPR for implant placement. And the thing is though too is a lot of these programs are constantly changing. They'll get new directors and it'll change. And I think it's important when you're a D3 or D4 if this is and this podcast should be anybody in any stage of their career looking to get into this stuff, but specifically for younger dentists, just reach out to these programs. Ask them if you can talk to some of their residents in the programs, and then ask the residents, are they able to place implants? Are they getting a lot of surgery, full edentulation, stuff like that? I'm a big advocate for getting very efficient with full edentulations. If you can get really efficient with full edentulations, laying flaps quickly, the implant placement, will come pretty quick. So just reach out to the residents, figure out, maybe what areas you want to go to, and ask them. And I'm sure they'll be very willing to tell you like what your experience is. Just talking to some of my classmates who did GPRs and AEGs, they're all over the place. Like some of them barely did any surgery at all, and some of them have been able to place 20, 30 implants.
Yeah, yeah. If I would go to say is if you're a practicing clinician out in the real world, going back to GPR is not an option. You know what I would do? I would call up your affordable dentures or some denture practice and say, hey, can I come work on Fridays? I guarantee you they're going to say yes, and you're going to be able to get some reps in there. You'll probably have a mentor in a lot of these offices. So that may be a really good place to start if you're a practicing, dentist, is just be like, hey, I want to extract 100 teeth every Friday. Okay, great. We'll have 7 or 8 patients lined up, and you can start.
Great. Yeah, no, I think that's fantastic. I mean, I really do like, I think we're all, pretty unanimous in that, full mouth edentulation cases are really one of the best places to start. I mean, in, situations where we've gone out to a clinic for their first surgery, I can always know how this is going to go by how long it takes us to get from numbing the patient up to getting ready to do alvea. Just like, what did the flap look like? Did we get the teeth out in a decent amount of time? Did we break a bunch of buccal plates? Are things intact? How quickly did we get there? Are we fatigued by the time we get there? And if you can just get that part out of the way quickly to where it's almost an afterthought and you're just focusing on alveo and placing implants, the whole thing is so much easier. And I think that was something that I had to get over a good bit because I pulled in dental school, I think I pulled 30 teeth. I mean, I had very, very little experience coming out, and getting quick and efficient with that really changed things. Just having a fresh set of eyes, getting to that point pretty quickly while the patient's still profoundly numb is really huge. So, and you can get exposure to that just by walking into affordable dentures and asking for a day a week or something like that. Maybe doing some prison dentistry where you're going to be pulling a whole lot of teeth. Just making sure you're getting exposure to that is huge because you can get really, really fast and really good, really quick. So,
yeah. And it's tough to, like, if you're doing an overdenture case, it's really difficult for the clinician and the patient, right? If you take 30 minutes to get a root tip out and that patient is in your 2 hours into the case and you still don't have all the teeth out, the patient's starting to, they're not numb anymore. Yeah. It gets really stressful really quick if you can't do these cases efficiently, and then the implants aren't even in yet. So getting efficient with basic extractions is definitely number one. And once you get there, then, like I said earlier, getting to the implant placement is pretty smooth. And I'll chat too about kind of some of the courses I took in dental school to prepare me for like basic implants. And when I was in school, I did all the Implant Ninja stuff, that's a very easy, like basic getting into just watching implant placement, some of the basics. They're not super expensive. I know they have like student discounts for that. Clark, do you guys allow students to come and observe at your course? What is,
You know, I've always wanted to have, and I've talked about having like a surgical one. The problem
Mhm.
is nobody who's out in practice wants to say that they're a beginner, right? So,
Mm,
demand is always low for that course. And then, you know, these are all cadaver based, right? And y'all know the quality of education that I put out. I mean, I'll
yeah.
spend $2,000 just on the freaking handouts for everybody, or maybe it's like
Mm,
3 grand. Um, and dinner's like 5 or 6 grand, right? But and that doesn't even cover the cadavers or the cadaver facility. So to put these on is expensive, and so then the other people
sure.
that want to take the course are the D3 D4 docs who don't have any money. So it's
yeah.
it's
It's
always
kind of
kind
upside
of
down
hard,
there.
right? I think the best thing is really just trying to get uh, get some shadowing under the belt, and
Yeah.
Mhm.
kind of starting from there. And the other thing too, this is like, do we give our patients free arches? Right? No, because if you don't have to pay for it, you don't value it. So then
Yeah.
that's the other thing that I go back and forth with. And
Hmm.
also, I treat my patients, everybody's the same. I don't care if you're a nurse or if you've got $100 million to your name. I'm going to charge you the exact same. I don't know. I've always liked treating people fair, right? So
Hmm.
those are just kind of my thoughts.
Sure.
Yeah, definitely. So yeah, I mean, if you're a practicing clinician, or even if you're in dental school still, one of the easiest things you can do is just find some basic implant CE. I've been going through just to get. I mean, I'm doing it to get CE credit so I can get some like fellowships. But there's the California Implant Institute as well. It's like
Hmm.
300 hours. It's all online. Stuff like that in your free time, just absorbing content is huge. So
Hmm.
that way, when you get to that point of actually placing implants, if you have those basics down and like how far, how much buccal plate do I need when I place my implant? How far away do I need to be from the adjacent teeth? Just those basics. Those should be just in the back of your head all the time. You should
Hmm.
know those, no problem. And if you go through enough content, that stuff should just be very basic for you. And those are just basic steps that you can do in your free time to help, just start down that implant journey.
Well, I think, register for an account on for.org. There is so many videos. And especially all the D3, like if you're new out of school as well, you have access to PubMed and all of the freaking journals. Read every article that Malo wrote. Read every article that,
Mm-hmm,
Aparicio
for sure.
wrote, before his zygoma days when they were talking about tilted implants. Read Davo. Read Ole Jensen stuff, and you're gonna get
Hmm.
so much out of that. And also if you're buddy buddies with the oral surgery guys, a lot of those guys have all of the books, all of the textbooks in, PDF. And so if you can get those, like Atlas of Oral and Maxillofacial Surgery, just, lots of reading, all that stuff's free, right? So,
Yeah.
just the more you put into it, the better you're going to get out of it.
Yeah,
Yeah.
absolutely. And I know I've talked about this on the podcast before. I was able to kind of use my last year of dental school specifically as like an oral surgery externship for the whole year, where I was just under an oral surgeon. He let me do all of the cases, and he just kind of critiqued me as I went. But that didn't just come out of nowhere. I reached out to so many people, and just asked if I could shadow, and I would spend many nights just shadowing these doctors before they allowed me to, comfortable for me to start doing these cases. And that doesn't just, people just don't give you that. You have to reach out to these people, ask them if you can shadow, ask if you can, just be watching them for their cases, and eventually they'll trust you more, and they'll probably start letting you do little things here and there that you wouldn't be able to get in dental school.
Yeah, absolutely. So, I mean, I think the summary there is, if you really want to do this, you shouldn't really have a hard time eating and sleeping and breathing it. You should be consuming podcasts and watching YouTube videos and looking at pans and just kind of imagining what could happen if you were going to approach it with full arch. I mean, this should be something that comes very naturally and something that you're excited about. And I think corollary to that is that you're going to reach out and you're going to find opportunities like that, and things will fall into your lap that might be a little bit unique or, really auspicious for you early in your career. But yeah, so as we kind of transition away from, people that haven't quite graduated school or just about to, that are talking about residency programs and things, I think we talked enough about that. So, let's say we've got someone that is, they've gotten themselves into an opportunity where they are able to get lots of full mouth extractions. They're doing flaps and things like that. What are some principles that they really need to be focusing on while they're working through those cases? What are the surgical fundamentals that they need to be working on? I'll kind of start off a bit. So we already mentioned efficient extraction. So if we could be a little bit more particular with that. So let's say you have a full mouth case, partially edentulous. You get maybe, I don't know, let's say 15 to 20 extractions on average for like a full mouth, denture case with broken down teeth and bone loss here and there. What kind of instrumentation are we talking about? How are we going to approach that? Personally, I feel like we want to keep that as minimal as possible. We don't want to need to have a whole bunch of fancy instruments, one different elevator or forceps for every different tooth. What's kind of the minimal armamentarium that we should be trying to get ourselves comfortable with while we're doing full mouth extractions?
Well, I mean, just, like you said, keep it simple, right?
Yeah,
so
totally.
You don't need a laser, just use a 15 blade, right?
Mm-hmm.
Also make it easy. One of the things that I recommend is the
Obtrugate or Oringer.
Yeah, there you go. Thank you. Yep, use one of the. I like the Oringer retractor. It's metal. It really widens things up. It doesn't flop out.
Yep.
And then retractors for your assistants, like a Weider retractor, a Selden. Whenever I do these courses, I see docs, going in with their finger.
Oh my god!
Retracting the cheek, and I'm like, okay, well,
it's the worst.
Use a Minnesota. That's what that's for, right? So if you just get those down, and then the next question is like, okay, well, how do I get the teeth out? Well, the first thing is you don't. Let's reflect, right? So as long as the biggest pearl I'm going to give anybody on this is, get your reflection done before you ever pick up an elevator, and before you pick up an elevator, pick up a high speed, with a friction grip 702, and I want you to trough, 3 millimeters deep, mesial buccal distal, and remove all that supporting bone. You don't need it. You're going to take it away anyways. And now you've reduced, the supporting structures that are going to hold in the teeth. And so now when you elevate, like if somebody comes and watches me, I'm going to have every tooth elevated, and I just literally lift them with the forceps extraction, right? Like I don't do any of this buccal, lingual, leaning stuff, because the teeth are already luxated out with the elevator. And so literally we take out an entire, an entire arch of teeth in, 45 seconds. They just pop right out. So before you pick up the elevator, pick up your, high speed 702. That's what I call it. It's an air driven handpiece. I use the NSK 45, and it's got air, ejected out the back. So you're not going to get any risk of air emphysema, anything like that. They're also built for oral surgery, so they are stronger. They're designed to last when you grind away bone. And when we use like this friction grip 702, it's a longer shank burr, and so it cuts well. It's very efficient. I also, on every surgery, I have a backup implant motor that has a straight attachment, and so I use a longer, your normal 702 that goes in the air driven oral surgery drills, just always as backup. But starting there, it's super simple, and then guess what? You don't need any of those fancy extraction forceps. I mean, like saying, "Oh, I want an 88 R and L." I'm like, what? What is that? I use a 150 and a 151, and I would say most of my molars, I section the crown off, and then I section out each of the individual roots, because it's so much better to the buccal bone. We harm our patient less, and it is so much easier.
I do the same thing.
That's kind of my recommendation for instrumentation.
Great.
Yeah. I every time straight elevator 150 or 151, and then I like an ash for anteriors. But my assistants know that, and it's good if you have minimal instruments, your assistants know exactly what you want at every time. It's much more efficient. Those are my 3 all the time: Molt 9 or Molt 2.4 for reflections. And then once everything's reflected, the teeth are out, and you already have a lot of that supporting bone gone. Then you can start next with the rongeur to clean everything out, and then you're on to your alveolo. For alveoloplasty, I like to use the Meisinger coarse barrel burr. That's my favorite. I don't know about you guys, but that tends to clean everything up really well and quickly. But if you do that the same way every single time, it gets very efficient.
Yeah.
And you'll have a nice smooth plane to put your implants in, and you don't have to be messing around with broken roots. And another tip I do is, if I do have a tooth that the root is broken, I'll wait till after my alveolo to finish that out. There's so many people that'll go in there with the 702 trying to trough around that whole root when they have all this supporting bone around it, and it just wastes so much time. If you do your alveoloplasty first, you can see, sometimes the rotation and the vibration of that alveoloplasty burr, the root will just shoot right out without even having to touch it. But if you do a flat plane, it's much easier then to get that root out after.
Yeah, no, 100%.